Is your cat's diarrhea just a mild stomach upset, or could it be a sign of something more serious? Finding a stinky mess in the litter box is unpleasant, but loose stools are something most cat parents will deal with. Hi, I'm Lyndall from Vetster, and today we're breaking down what's normal, what's not, and when it's time to call a vet for your cat's diarrhea. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
First, let's talk about how to identify the problem. Diarrhea is not always just watery poop. You might also notice your cat straining, going more often than usual, or even having accidents outside the litter box because of sudden urgency. The stool might change in volume or color, and you may see mucus or even a small amount of fresh red blood. While seeing blood can be alarming, it is often caused by irritation in the lower bowel. However, it is still an important detail to share with your vet. Pay close attention to how long the diarrhea lasts. Acute diarrhea usually clears up in a day or two. Chronic diarrhea keeps coming back or lasts for weeks. Your vet will want to know these details to help determine whether the issue is coming from the small intestine or the colon, which helps identify the cause faster. It is important to remember that diarrhea itself is not a disease. It is a symptom. For otherwise healthy adult cats, the most common trigger is dietary indiscretion. This is just a clinical way of saying your cat ate something they should not have, such as a sudden new food, items from the garbage, or spoiled scraps. Cats have very sensitive digestive systems, so even small changes can cause a big reaction. Food allergies or sensitivities are another possibility. These can develop at any age and often require a carefully managed diet trial under veterinary guidance. If you suspect food may be the issue, a virtual vet can help guide you through that process safely from home. Other common causes include parasites like roundworms, Giardia, and tapeworms. Even if a fecal test comes back negative, your vet may still recommend treatment because parasites are not always detected with a single sample. Bacterial or viral infections are also a concern, especially in kittens or unvaccinated cats. These cases often come with other symptoms like vomiting, fever, or low energy. In some cases, diarrhea can be a side effect of medication or a sign of an underlying condition such as kidney disease, hyperthyroidism, or inflammatory bowel disease. So, when should you stop waiting and call the vet? You should seek veterinary care if the diarrhea lasts longer than 24 hours, or sooner if other symptoms appear. Call right away if your cat is vomiting, acting lethargic, or refusing food. You should also contact a vet if you see a large amount of blood or black, which can indicate internal bleeding. This is especially urgent if your cat is a kitten or has an existing medical condition. Kittens are particularly vulnerable because they can become dehydrated very quickly. When in doubt, it is always better to check in with a professional. While you are waiting for an appointment, make sure your cat has access to plenty of clean, fresh water to stay hydrated. Never give your cat human medications, and do not change their diet or try fasting unless your vet specifically tells you to do so. To help reduce the risk of future diarrhea, transition new foods gradually. Keep garbage, toxic plants, and table scraps out of reach, and stay up to date on vaccines and parasite prevention. If you are worried about your cat right now, you can book a virtual visit with a licensed Vetster veterinarian and get expert guidance from the comfort of your home. Check the link in the description for our full guide on cat diarrhea and symptoms to watch for. Thanks for watching, take care, and we'll see you in the next video.